Delta subvariant is currently on the rise in the UK. According to the UK Health Security Agency, this descendant of the Delta variant, known as AY4.2, accounted for an estimated 6% of their cases for the last week of September. Little is known about this subvariant. Some experts suggest it could be slightly more transmissible than the original Delta variant, though that is yet to be confirmed. Currently, it is not yet deemed a variant of concern. To better understand this, Dr. Surani joins us live this morning. Dr. Surani, it's always a pleasure to see you, and on a Friday especially, since we usually have you on just Tuesdays and Thursdays. When you saw this news, what did you think? And I also want to mention that right now Moscow is going on a 10-day lockdown because cases are rising there. Also, problems in the UK, as we just mentioned here with this variant, but it's in stark contrast to Australia, which is reopening finally after a year and a half shut down pretty much.
Good morning, John. Good to be here. One of the things, whatever happens anywhere in the world, it comes to us. So you won't be surprised. Actually, this variant AY42 is already in U.S. The numbers in the U.S. are much lower than what we are seeing in UK. In UK, as you mentioned, it is about 6%. So it means that it is becoming gradually, it's not one of the most dominant variant, but it has started picking up. What it does is what they feel that it is a little bit more transmissible, but at the same time, they're not too much worried because when the Alpha variant was there and the Delta variant came in, it was at 50%, 60% more transmissible. So the number of the cases were going very high. On the other hand, this one is about 10% what they estimate is to be more transmissible. So the number which is going is not that high, and more people have been vaccinated. And so far, the vaccination is holding pretty good. The cases in the U.S., they already had several cases in U.S. with AY42, and that number is still less than 1% of the total cases. So that's good news that the number is low. But again, we are seeing cases. Israel reported the case of the AY42. UK is rising. Good news is Denmark had a lot of the cases of Y42, but they have shown some decline. So I think we just have to be very vigilant, keep an eye on it. It's a little bit more transmissible, but not as much. And good thing is vaccination still seems to be holding pretty good for this variant.
Well, Dr. Surani, we've heard a lot about the variants of COVID, but subvariants we haven't really gotten into. Why doesn't this have an alpha, delta, one of the Greek names attached to it yet?
Yeah, even we hear about the variant, but you're right, we don't talk about the subvariant because when the Delta variant came in India, there were two subvariants, so initial variant and the second one. The second one was actually the more transmissible, and now you're having a subvariant where they get a chance and they modify, and that's the way the virus does it, that they try to find a way for survival, because if the vaccines are coming in, more and more people are getting vaccinated. They try to modify and see where they can modify and they can try to exist. So the virus is right now fighting the existence war. And if you look at the number of the people who have been vaccinated in the world, almost 6.5 billion people have been vaccinated in the world, and almost 22 million people are getting vaccinated every day. But the challenge is that there's a lot of disparity. So if you look at a country like Afghanistan, only 1.2% have been vaccinated. In Tanzania, less than 1% have been vaccinated. In Africa, the vaccination rate is about close to 6%, whereas in some countries in Europe, they're at 80%. So I think one of the key factors is that no one is safe till everyone is safe, and the effort has been made to make sure that we try to get the global vaccination done so the virus doesn't have a chance to replicate or try to find a variant or a subvariant.
Dr. Surani, a lot to take in, but we just want to make sure our viewers are aware of that. Nothing to fear. Just pay attention to what's going on out there. And like you said, get vaccinated and be sure to mask up. Dr. Surani, thank you so very much for your time. If you have a question for Dr. Surani, as always, you can send us a text at 361-855-6397.